Hey, good morning, everybody. When we think about healthy air, many of us are thinking about it for the first time. We've all gone along just sort of thinking about don't worry about nothing, nothing will be all right. And this pandemic has certainly proved to us that we need to pay more attention to things that are going to affect us in the workplace and the quality of our experience. So, we got a terrific discussion today with two highly competent industry professionals, and so let's get to it. So I'd like to bring on Mike Woolley.
Thanks, Russ. Appreciate it. We're going to get it started with a little video, and then I'm going to do an introduction of our two main presenters. So as we get into the presentation, we've been bombarded with a lot of information over the last year about technology and things that we can incorporate into our buildings, both from a physical improvement and an operational improvement. And, one of the things that we're really, focused on, who are our trusted sources of information? What is right for your venue? Where do you need to make those appropriate investments in your building in order to meet, guidelines? And so I'd like to introduce our two main presenters. Josh Robison is a 30-year industry professional, and he's currently a project manager at Venue Solutions Group. And John Licata, who had spent 14 years at Madison Square Garden in operations, and in the last two of those years, he was the VP of operations. And now I'm going to hand the presentation over to John.
Thank you, Mike, and thank you, Russ, and welcome, everybody. Thank you for joining today. We're going to start out by looking at the evolution of transmission, find out how we got here, and of course, how to best move forward. So it all started right here with surface transmission. Can you believe that it was over a year ago that we were elbow bumping, we were wiping down deliveries and groceries, and wearing gloves everywhere we went? And we didn't really know what was going on or how long it would last. But while this was all happening, we were still open. We were still operating, and we were still operating at full capacity. So we had to build confidence. We had to build confidence for our staff as well as our guests. And this confidence was built around visual elements: hand sanitizer, surface wipes, antimicrobial soap, disinfectants, electrostatic spraying, and many other elements. And it didn't take long to evolve into droplet transmission. And even though by this point we were closed, we still had to build that confidence. At this time, it was built around mask wearing, social distancing stickers, plexiglass. We all had to pay attention to this new 6-foot rule, and what did that mean for our venues? What did that mean for capacity? So we had to develop strategies around limiting guest and employee interaction and building out pods. And again, these were all visual elements that our staff and that our guests would understand, they could see, and they could have their confidence. And that took us to airborne transmission by way of aerosols. So we could visualize contaminated air if you picture cigarette smoke in an arena, or an abundance of haze, or even the smell of truck exhaust during a monster truck show. But you can't see or smell viral aerosols, and they may not spread evenly either. They could cluster in certain areas. So what do we do? How do we build that confidence? How do we create that safe environment for our staff and guests? Well, the CDC states when indoors, ventilation mitigation strategies help to offset the absence of natural wind and reduce the concentration of viral particles in the indoor air. Well, that's great. Ventilation mitigation strategies. What are those? How do we do it? Well, similar to surface and droplet transmission, you need to build out a strategic plan. Establish your goals, build out your strategy, create your actionable documentation to move forward. So what are your goals? Well, your goals should be centered around 4 basic principles, starting out with offsetting absence of wind. Indoor venues, they don't have natural wind, right? So they need to bring in outside air mechanically or through other creative ways. Maximize air circulation. This is your air changes per hour, especially with outside air. Understand your capabilities. Understand your capabilities in the bowl, in the concourses, and of course, other key areas throughout your venue. And the goal should be focusing on maximizing these air changes per hour. But not only per hour, how many air changes can you be doing prior to occupancy to flush that air, create that clean bowl for your staff and your guests? And this is what starts the science behind your planning. Reduce presence of viral particles. Pretty much the basis behind all of your goals, but what's the method? Are you flushing air? Are you increasing filtration, whether that be in your main system or locally with portable HEPA filters? Installing air sanitizing technology, all the above. You need to find out what works best for your venue and in what application. And building that staff and guest confidence. This is extremely important. You did it for surface, you did it for droplet, and now it's time to do it for airborne transmission. So you've established your goals. How do you obtain them? It starts with a strategic review. You need to navigate all the information that's out there. Is it an alligator or is it a log? Find clarity and understand how the latest information pertains to your venue, and then be ready to adapt. Evaluating systems. Control what you can control. What are your capabilities? Are there repairs that need to be made before you even consider upgrades and enhancements? Your physical assessment starts to build the science for your enhanced strategies. This creates a benchmark for current and also future enhancements. Best practices. I mean, the one positive element out of this pandemic is that we're all in this together. Nobody's alone. And we can learn so much from what other venues are doing, even the league mandates that are out there now through the NBA and the NHL. But keep in mind, even though we're all in this together, we're certainly not playing with the same hand. There are older venues, there are newer venues, venues that are in new construction at this time. And that's okay. Learn from everybody, but certainly don't get discouraged if people are implementing strategies that maybe your venue isn't ready for at this time. And that takes us to our last element, which is customizing a program. While you're learning from other venues, you certainly need to customize a program that works specifically for you. Develop a plan and take action. So what are the next steps to taking action? Well, this takes us to our 4-step process. And throughout this presentation, we'll take you through all 4 steps, starting right here with clarity.
So talk about information overload. It's coming from everywhere. The CDC, ASHRAE, governor's office, the mayor's office, local health departments. If you have a professional sports team, it could be a league mandates. And now there's the possibility of OSHA regulations coming. The White House recently reached out to OSHA to get involved and develop worker protection guidelines. Are these requirements, or are they just guidelines or recommendations? And how do they apply to your facility? And keep in mind, these guidelines and recommendations are constantly changing. How do you even keep up with the latest and greatest? What a headache and confusion that this creates. So what are the steps? Develop a team tasked with staying on top of all the information. As you've heard discussed in previous back to work seminars, reach out and talk to your local health officials, whomever they may be, your health department, your mayor's office, your governor's office. Find out what they're looking for and let them know that you are engaged in what you're doing to minimize that risk. You can consider a third-party consultant who's going to be able to help you stay abreast of the most recent guidelines and recommendations, whether it's federal, state, or even local. This allows your staff to focus on their job and free up resources. Once their survey has been completed, they can produce a written report that can be submitted to these officials that you're working with. And possibly the biggest advantage for third-party engagement, it will give validity to your information and the science behind it. All of this helps to give a clear path forward to use in policies and procedures, public information campaigns, and possibly a roadmap for facility improvements or CapEx projects if needed.
And this takes us to our second step, assess. This is the step where you evaluate your system and your capabilities. Now, most existing strategies around indoor air quality have been primarily based around three main concepts: comfort, ventilation, and energy efficiency. And these are all very important, but they're just the tip of the iceberg. These focus on temperature, humidity, CO2 levels, and energy consumption. But we're now in a position to create back to work strategies. Build plans for your approval to reopen. Build plans to establish that confidence for your staff and your guests. And it's important to note that this isn't a shift in priorities at all. This is an expansion of priorities. And in order to build these new plans, you need to first assess your system capabilities and find out what you can do to develop these strategies. So what are you assessing? Air changes per hour. Do you know your numbers? Do you know if you meet or exceed CDC and ASHRAE guidelines? This is a crucial assessment to build your plan around. Increasing outside ventilation. Can you bring in 100% outdoor air? And if your system capabilities don't allow that, how can you get creative? What else can you do to bring in that outdoor air? Improving filtration. Can you accommodate a higher MERV filter? And we'll touch on this a little bit later in the presentation, but there are side effects to increasing the MERV rating of your filters. And are you also considering local filtration in specific rooms as well? Exhausting contaminants. Dedicated bowl exhaust fans, smoke purge fans, restroom exhaust, hood exhaust inside your kitchens. Are all your capabilities functioning as designed? Are you exhausting all the air throughout your building as needed? And now, while you're evaluating your system around these strategies, it's no secret that these new enhancements may have a direct effect on energy efficiency. You're pulling out the air, right? You're exhausting your conditioned air. Now you're bringing in outside air, which may need to be cooled, it may need to be heated, it may need to be dehumidified. And this all takes time and it takes money. So it's extremely important to understand what this means for your venue and of course what it means for your operating budget as well. And promoting healthy air. This is extremely important. Communicate your strategies and plans. Take a look at your existing procedures now and how well they're communicated throughout your venue. Your engineering staff, we all want to be back of house. If there's no problem, that's a good problem. So typically venues don't communicate what they're doing for indoor air, but times have changed and now it's time to promote what you're doing and build that confidence for your staff and your guests. And all these strategies here, these new strategies that you'll be implementing, they all tie back into comfort, except this time it's a different type of comfort. Now it's a cognitive comfort. It's the comfort of feeling safe. And it's also important to know that providing or promoting healthy air, it's here to stay. Thankfully, as vaccinations go through and as time evolves, certain elements everyone's been planning and doing will go away. But providing and promoting healthy air is certainly here to stay. And it could have an effect on artist and client requirements too. A couple of quick examples. Think about a concert. A concert comes into your venue. Let's say you have 5 Arena Bowl fans. Maybe you're turning 2 of them off over the stage and the other 3 you're dropping down to 25%. And an hour before doors, the promoter comes out, he points up at the scrim and tells you that it's still moving too much. So you need to slow down the air in your building. Well, now these promoters, artists, clients, they might focus on air changes per hour. They might focus on increasing outside ventilation, just moving air. So that promoter that would always tell you to stop making the scrim move, they might come out now, point at it and say it's not moving enough, because they want that visual to understand when you're at capacity, they want the air moving. They want the air to be cleaned. Another example is haze. Pumping haze throughout the building. If you're moving that air, you're going to be exhausting it out. So it could change strategies for shows, the look and feel for shows. Some may do away with it, probably not. I think what it could mean is they're going to be adding a whole lot more. So what does that mean for your venue? Because you know it's an exhausting outside. It's traveling through out of the bowl into the concourses into other rooms. So just more things to continually think about. So you establish your goals. You walk through the information, develop clarity. Now you've assessed your system. It's time for our third step, which is strategy.
So how do you achieve these goals? Air filters can help achieve the desired elimination of particulate matter. The CDC's ASHRAE recommendations currently are asking for a MERV 13 or higher filter. That's great, but some of our systems can't handle the static pressure that will create. We'll talk a little bit more about that. There's UV technologies as a potential viable option. There are many different locations available to install these systems throughout your facility. They can be placed in air handlers, inside ductwork, ceiling mounted units. There are safety concerns, however, that have to be adhered to due to exposure to UV light, and those will need to be addressed. It's not a cheap technology either. In the end, it can run tens, even hundreds of thousands of dollars, and it will need to be engineered for your specific application. Bipolar ionization is another option for neutralizing. Again, like UV technologies, there are cost considerations to keep in mind. It will also need to be engineered for your specific location. And bipolar ionization can be somewhat harder to measure end results. Localized portable units using HEPA air filtration is another option. They allow specific targeted placement. They work great in smaller areas such as locker rooms, dressing rooms, office areas, and other similar areas that you have in the building. A great benefit of portable air units is that they can be either rented or purchased. And sizing the units are fairly straightforward, just using the estimated square footage of the area that they're going to be used. The other option, creative approach. Get outside the box. What are things that you can do that are unique to your facility that can be done for no cost or next to no cost? Are you able to manually drive open your outside air units using your building automation system? Can you open exterior doors and draw fresh air through the bowl and concourse units using your bowl exhaust fans? Get creative with your facility and see what will work in your building. But keep in mind, as John said, what works in one building might not work in another. So see what works and don't get frustrated with it. So what you see here in front of you on the screen is an example of a typical 20 to 25-year-old building, probably around 10 to 12,000 seats. Keep in mind that this building was built using the building codes and methodologies of that time. This example is showing us a couple of things. Look at the bowl air handling units. Based on their total CFMs, they can do almost 2 air changes an hour. That was great when the initial CDC and ASHRAE guidelines came out, calling for at least 1 air exchange per hour prior to opening doors. Now they're calling for 3. The trick is this is a fixed number. You can't change this number without doing mechanical upgrades such as additional units. This can only do what it can do. But then let's look at that outside air number. This is the minimum outside air that can be brought in. Keep in mind, we've done a 180-degree thought process. Up until just recently, we've always, as an industry, done everything we can to keep outside air out and just bring in the minimum outside air. Now we're bringing in as much outside air as we can in conditioning. So now back to that outside air number. That number can be driven higher by increasing the draw through your building automation system. The more fresh air we bring in, the better. This number is unique to your facility and is going to be proportional to what your units can do and what they're capable of. The other thing I want to point out, and I want everyone to be very cautious of this, look at that filter rating. That system is designed for a MERV 8 filter. These systems, much like some of yours, was designed around that MERV 8 filter. And with a lot of the air handling units that we have, you just can't increase the MERV rating to a 13 or higher. You run a risk of system damage or failure due to that increased static pressure that creates. You can collapse the filters, you can blow ductwork apart, you can damage fan motors. There are a lot of different damages that can occur. Get with your local mechanical contractor and help on upsizing your filters, because it's not as simple as simply replacing them. You know, the one thing I want to point out is that these recommendations that we're talking about are just that. They're recommendations and guidelines. Nothing yet has been declared a requirement. You aren't required to put in a MERV 13 or higher filter, but it is recommended. And the guidelines even state that to use a MERV 13 or higher filter, or the highest rated filter your system can be.
And this takes us to our fourth step, which is recommend. So what types of recommendations should you expect? Physical enhancements. What makes sense for you right now, and what features could be phased in over the next couple of years? There may not be reasons to go out and spend the money that you don't have, you know, on these physical enhancements, where there are other creative approaches you could take, like Josh explained, and maybe you can plan on installing additional enhancements a little bit later once the revenue starts coming through. Policies and guidelines. So you're taking the most up-to-date CDC and ASHRAE information and you're applying it to your venue. This may result in new procedures that need to be documented and communicated out to your staff. No matter what you do as a venue, the calls will never stop coming through as far as, can you make it a little bit cooler? Can you make it a little bit warmer? Those calls won't stop coming. But what's extremely important is that you communicate what you're doing at specific times so your staff understands that maybe it's not as easy now as making it a little bit cooler or warmer. So for example, if you're flushing the air before doors and you're bringing in cooler air, people might call to make it warmer. But over that 2-hour period, 3-hour period, maybe you're not doing that. So you don't want to create stress. You don't want to create miscommunication. You want everybody to be on the same page. So it's important that when you enhance your policies and guidelines, you're communicating that out. Training. This is the staff execution portion. You want to execute consistently. Of course, you want to get everything done correctly, but you want to be consistent. You'll have different staff coming through 7 days a week for 21 shifts. You want to make sure everyone's on the same page. It could be a stressful environment when everybody is open, especially at full capacity. You want to make sure everyone's on the same page, trained, and operating consistently. And communicate. This is extremely important. In many cases, staff and guests cannot see what you're doing. This isn't the hand sanitizer dispenser. This isn't the social distancing sticker on the floor. This is clean air. So you need to promote your healthy air strategies with messaging, with signage, or any creative tactic that works for your building. Give people that comfort of feeling safe. So, okay, we spent a lot of time discussing healthy air, and now we'd like to quickly touch on a few other important elements to focus on as you reopen.
So in our buildings, it's water, water, water. We have water everywhere in our buildings. Sometimes we tend to forget how much water we have in our buildings. We have water in our mechanical systems, kitchens, concession areas, water fill stations and drink stations, sinks, toilets, urinals. We have water everywhere. So take a look at this headline. This is the CDC offices in Atlanta. When they went to reopen after the initial shutdown, they found Legionella in some of their water systems. And I'm telling you, if this can happen to the CDC, I can pretty much bet that this can happen to any one of us in our buildings. And I can't stress this enough. Have your water tested. Work with your local water treatment company and test your water everywhere. These various water systems in our buildings have potentially been sitting and who knows what all kinds of organic bad stuff is growing in them. Get your water tested. Restart procedures. Now it's the time to start looking at getting all of these systems back up and running to capacity. This includes everything: your mechanical systems, your chillers, your boilers, pumps, exhaust fans, kitchen equipment, hoods, fryers, ice machines, walk-in coolers, your life safety systems, your sprinklers, your generators. Conduct their annual tests and get them certified. This is also the time to catch up on your preventive maintenance and repairs. Equipment not running or not running efficiently won't do any of us any good in achieving these goals that we're trying to achieve. Any air handler or fan not running properly is just going to subtract from the air exchanges per hour that we're trying to achieve. Reach out to your local suppliers and contractors this time. Find out what the lead time on your supplies are. A lot of manufacturers have been majorly impacted during this pandemic shutdown, just as we have. We're seeing lead time stated in months now instead of days or even weeks. Your contractors are in the same boat. Everyone is calling them for service right now, not just us. Office buildings, schools, warehouses, everyone is calling for service. And your contractors are struggling to get and keep supplies as well. And they may be down on manpower in addition to that. So reach out to your contractors, to your suppliers. I can't stress that enough. The lead times are really exaggerated. The last area I want to touch on all of this is what I call unventilated areas in our buildings: storerooms, janitors' closets, other areas of the building that may have exhaust, but not necessarily a supply of air. Get these rooms opened up so that you can flow surrounding air through them using the exhaust systems that are currently there. One special note that you may want to pay attention to are, a lot of buildings now have server rooms. Due to relative humidity restrictions, they probably don't have any outside air. These specialized areas, and you may have other unique areas in your building similar to these, they'll need to be addressed with a local mechanical engineer or contractor, as you have staff that spends a considerable amount of time in there. We need to make sure that we give them clean air.
And this takes us to survey benefits. What are the key takeaways and benefits with an assessment and a survey? Well, it goes back to our 4-step process, starting right here with clarity. It's extremely important to find out if you meet or exceed the CDC and ASHRAE guidelines. Assess. Your physical assessment shows the science behind what you're doing and why you're doing it. Strategy. Enhance strategies for healthy air. Be proactive and communicate what you're doing. Answer those questions before they're asked. And recommend. Within these recommendations, you'll establish your benchmarks for current and future enhancements. And you'll have that third-party validation backing everything that you're doing now and that you're looking to do in the future. And this all leads us to healthy air. This 4-step process will bring you closer to healthy air and build confidence at your venue for your employees and your guests. So now it's time to take action. Go ahead, perform your assessment, enhance your strategies, create your actionable documentation, and promote your confidence around healthy air. Well, thank you everyone for your time, and now we will send it back to Mike Woolley.
Thanks, John. I do, before we kick it back to Richard, I want to thank you for everybody's participation today and giving up their time to be in the webinar. And now I'll hand it over to Richard, and Richard will talk about our upcoming webinars.
Or not, Listen, while we're catching back up with Richard, we do have a couple of we do have a couple of things in the questions, and you're encouraged to add your questions to the Q&A area. Paul Turner asks what MERV stands for. Paul, I feel compelled that we should probably charge you for this, but thank you for asking that question. I'm sure there are many people on on the call who have the same question. It's a minimum efficiency reporting value. The higher number of MERV, the more efficient the filter is with regard to trapping small particles. John, do you want to answer the question? He has a similar question about ASHRAE. John?
I think John or Josh on that one.
All right, Josh.
ASHRAE is the American, or the Association of the American. Let me try that one more time. The Association of Heating and Air. Hold on, I'll get you the exact.
No, you've been a member too long. It's the American Society of Refrigeration and Air Conditioning Engineers.
Thank you.
All right. So, Mike, back to you on the Q&A.
Yeah, absolutely. Christopher Hecox has a question. It says, what is the recommendation for air changes per hour in theaters?
Right now, I don't think we're seeing any specific language for any of our buildings outside of what the NBA and NHL has implemented for the arenas. So I would defer back to the ASHRAE recommendation of 3 air exchanges per hour prior to opening doors.
And if I could expound on that, it's really what we're seeing across the nation is there are different requirements or recommendations. Obviously, some public health departments want more, probably more than what you're able to do. And that just becomes a conversation where that engagement with the public health department becomes, or your municipality leaders to say, hey, this is what we're capable of doing without making a major investment. If you want us to get to a higher standard, then it would require some investment in our upgrading our mechanical systems. And then Paul Turner has a question about, are there examples of venues you know that have done specific things? It would be good to get some real life examples.
Yeah, so there are examples out there of a great one. I think is filtration. I think even some of the newer venues that were built with MERV 13s are upgrading to MERV 14 or even MERV 15. But we've heard of some examples of venues that were built and have a MERV 8 filter. They upgraded to a MERV 13. And then within an extremely short period of time, they created too much pressure and it simply blew out the filters. So it's just as important as it is to find out what everyone else is doing. That's why it brings us back to the assessment to find out, does it work for you and will it fit in your building? We don't want venues to jump out and know the majority seems to be doing X, Y, Z, so let's just go ahead and do that before we look at our capabilities.
And also we have a venue that, and Josh brought this up, that, you know, prior to bringing the fans into the facility, they open their doors to increase, you know, to allow them to flush the building. So not only are they pulling air, you know, through their mechanical systems, but they're also opening doors, having to staff doors, obviously from the security standpoint. So I think understanding your system capabilities and limitations would then allow you to say, okay, what other strategies can we deploy? Can we do other things like open doors and be able to flush the building at a higher rate? So we've heard about that as well too.
And that also goes along.
Almost everything that's been discussed is being done in some level throughout all facilities. We're familiar with facilities that are having their water tested, for example. There are facilities who are conducting assessments, trying to understand how they were operating and how they need to operate under the new environment. And I think depending on what state you're in, the rush to reopening now has caught some people flat-footed. Other people have been sort of prepared all along, but as the momentum goes forward and event activity starts to become a reality in your unique location, there's going to be some amount of catch up. And part of the spirit of this entire conversation was to be able to say, hey, here's a menu. As Richard will tell you at the end, I mean, we put this up on our YouTube channel. You can share it with everybody. It's intended to be just a guide, a discussion guide, that these are the kind of things that you should consider, regardless of where you are in the continuum of opening a new facility or opening your facility again for the first time.
And I want to add real quick. Again, we mentioned what works for one building might not work for your building. Take the opening the exterior doors as an example. While that works in some locales, if you're in a far northern state where it's 20 degrees, that might not work for you. Your system might not be able to recover drawing in outside air that's 20 degrees in time for the event. Same way if you go farther south, a Miami type application where it's 95 degrees, 95% relative humidity, your system might not be able to catch up. So those might not work for you, but they can still work for a number of other buildings. So look to see what works for your building and play with it. Don't wait till the day of the show to try to do it. Do it on a Tuesday afternoon when nobody's in the building.
And I would think everybody in this group would agree that the best advice is that you have contacts, you have connections, your engineering people, your operations people. In this case, we tend to relate to people who are also in public assembly facility management. But within your community, you've got organizations, you've got organizations and other commercial facilities that are somewhat like you. Having a network of people who can help to answer the questions, to Josh's point about your unique environmental conditions, that type of thing. We highly encourage people to reach out, share information, and you'd be surprised what you learn and where you get good contacts going forward.
All right, next question, Eric Neal. I'm at a performing arts center and we just had a presentation by Active Pure Technology. Is anyone looking at this type of technology? They showed us the Aris hydroxyl blaster. We have taken and have taken a lot of presentations from a lot of different companies about air treatment, ranging from, air oxidation, UVC lighting. There's a lot of folks out there that are pitching technology, and I think you have to evaluate each one on its own merits. I mean, obviously, investment and cost plays a role in that. The thing is when you're talking to these vendors is, the scientific data. I mean, I've had multiple venues call me and say, is there a scientific study? I want to consider this technology, but my board won't, probably won't move forward unless I can show that there's scientific studies that say it is, that it is 99.9% effective against COVID-19. I haven't seen scientific studies. There's anecdotal evidence that says it does work. So I think you just have to evaluate each of these technologies and whether they are appropriate investments for your building.
I would follow up on that, and I would just share with you directly. I'm never somebody who's going to be a beta tester. I'm not comfortable being first. In fact, I'd rather be last of the last thing than first of the next thing. And listen, you shouldn't do something because I do it, but I can just give you that's my perspective. And so some of the first questions I have for people who are advancing technologies to this team, because as Mike said, we get a ton of calls, a ton of people are interested in sharing information with us, is like, where is it right now? Like, where is it working? And then being able to talk to your counterparts about what was it like, what was the communication communication and information during the ramp up of the technology, what was the install of the technology, what were the issues that you didn't anticipate and how you learned, and sharing that information makes it a lot easier for the next person and the next person and so on. So I go back to this, and part of why we're partnered up with IAVM from like a universal standpoint is that this type of information and this kind of discussion is critical for all of us to just remember that there are people out there that will help us. They're not going to charge us. They're just going to have that conversation. And the first question I ask any vendor is, tell me where this is installed, because there's a really good chance that I know somebody in that building, and then I can get sort of an honest opinion. I would just tell you from our perspective, this group of people takes no direct or indirect benefit from any product, good, or service. We're interested in understanding how things work so we can convey that information to the people we work with and for, and that includes the industry as a whole. So having that type of environment and being sort of Switzerland in terms of no benefit to one thing or the other just allows us to stay as current as possible and to give honest and clear information to people who are considering these kinds of technologies. And as John and Josh have mentioned a couple of times, every building's different. And whether it's how it's built or how it's managed or what kind of resources they have or timing, all of that's different. But you can usually find someone else who's at least in your zip code in terms of the facility type. Performing arts were mentioned. We've had people who have questions from stadiums, that type of thing. There, with a little bit of actual effort, you can actually mitigate or narrow any risk you would be taking as you move forward with this or any technology.
Great. All right. Paul Cathy says Actors Equity is requiring 6 air exchanges per hour. I haven't heard 6. I've heard 6 in the Bay Area.
And that would be highly desirable, right?
Right. If you have the ability to do it.
That's exactly right.
Yeah. Craig Kaufman, it says, having a plan is great, but how do you confirm the facilities are actually doing the planned maintenance? Important to keep logs and make them available to tenants. I'll kick that to Josh if you had a comment about that.
Yeah, absolutely. The documentation of what we're doing is key. Whether you have a CMMS program, computerized maintenance program, or even handwritten notes, you've got to document. As I mentioned, we've got to maintain these. We have to maintain this equipment. We have to have it in top operational condition, because if it's not able to achieve the design, and you're not going to truly be doing the air exchanges per hour that you think you are, or that the documentation is key. That is part of the science that goes along with the reports that you're gonna want to give to your local officials.
And that's where assessments come in. Having a third party just say, hey, where are you at? Well, we couldn't get all this done. Okay, why? And then what can we do to actually improve it? And that doesn't mean you have to eat the whole apple at once. But listen, if you don't know where you are, any road will take you where you're going. Okay, so I think this is an expected industry standard, but unfortunately, I think there are some people in operating circumstances where this is challenging. And so, Craig, that's a good question.
Okay. Michael Metzdorf says, have UV or bipolar ionization technologies been proven to mitigate COVID-19? Is one better than the other?
Good question. And I don't know, they all attack particulate matter differently. One better than the other is hard to tell. You're looking for measurable results. Again, we're not here to recommend one technology over the other. It's more of the application. Where are you able to install this technology in your building, and how it applies to you. At the end of the day, I believe most testing, for particulate matter is conducted in a 2 foot by 2 foot box. With a predetermined amount of particulate matter, and it's measured on, the inactivity of that matter. It comes back to what works for you. again, we're not here to say one is better than the other.
There is some empirical evidence that you could consider as well. And when we talk about UV technology, we're really talking about UVC technology. There is also UVA technology. But UVC technology is being deployed in surgical and in healthcare environments. We probably don't all think about this, but I think this team right here would agree that we look at hospitals and healthcare facilities for leadership in many of these areas because the standards that they have to comply to are far higher than anything we would find in a public assembly facility. So when I see a UVC technology being utilized, beginning like, the Mayo Clinic, for example, began to bring that into their surgical suites, that type of thing. It was really based on some not COVID, but so similar types of issues than COVID. So that actually that leads me to think, oh, that's something worth paying attention to. And as they expand that in those type of industries and other industries where this is critical, that starts to give a level of comfort about, okay, this may be something that we should think about. It goes back to what I said earlier. We also want to talk to those folks. I mean, there are engineers in hospitals, and some of them are your neighbors. There's ways to find out how it's working, and are there issues with shadowing? And there were issues in shadowing for some healthcare, and so they actually developed some hand wands that you could use when the robot finished what they did. You could go into some of the shadow spaces and those kinds of things. I know that Levi Stadium, for example, has purchased two of the sort of robot devices. I don't remember the exact brand, and may actually get some more. That they did their research and due diligence, Jim Mercurio and his team, and they felt like that this was going to be something that they were comfortable and confident in terms of making sure that they were delivering the cleanliness in those spaces, both in the general areas, but more importantly in their locker rooms where MRSA is an issue. So with regard to the bipolar ionization, there are a number of good companies out there who are putting these. We're seeing a lot of it in new buildings and new installations. Those installations had a lot to do with locker rooms and offices. I think we'll see those expanded now as we go into other areas. And so, again, Josh's point is a great one. We're not saying it's A or B. We're saying there is a lot of information out there that all of these technologies are currently being deployed. And so there are people that have boots on the ground information about their value.
Great. Caroline Morrison-Pegg, any advice on changing public perception regarding safety of live event venues? Russ, I'm going to have you answer that question.
Yeah. My advice starts with the word transparency and is followed by a foundation of communication. And I guess my straight on advice is you have to look for every single thing that you can find that it's like laying a brick wall. You have to lay as much foundational information as you can, because it's going to take part of our audience a pretty significant psychological leap to move back into a mass gathering environment. There's a part of our audience, mostly our younger people, that, if we threw everything open tomorrow, they'd be happy to be there. But I think there is a group of people that we are going to have to remind them. And, and again, in a conversation like this, it just needs to be an honest conversation. Some of that is likely some theater as well. I'm someone that I don't believe that the science justifies temperature checks. But for your guests, I have a completely different attitude about employee temperature checks. But if you felt like in your community that temperature checks were going to be something that would keep and make your customers more comfortable in coming, then that's maybe something you should consider. It's not a downside to do it. There is a cost and there's a timing factor. There's nothing wrong with doing it. So if you're looking at programs like building, or you're looking at programs like GBAC, or any kind of local program, or programs that might be available through your vendors that could help to create an environment where the people who are considering investing their time, their dollars, and now their health and safety into coming to your event can feel like that you've done everything humanly possible to keep them safe. And it's the same conversation we had after 9/11 with security. We've been through this before. We know what those actions are. The best example that I can use has to do with housekeeping and sort of the Disney system. Disney was put all of the mechanics of how you deliver your services so that people can't see them. So we picked uniforms for our housekeeping that made them disappear in the crowds. Now, just like security post 9/11, I believe we're going to need to see visible and obvious evidence that our housekeeping and cleaning personnel are actively engaged in that. The fact that surface contact doesn't no longer appears to be a vehicle for conveying the disease is irrelevant. It doesn't hurt us to be cleaner. It doesn't hurt us to have the perception that our people are, not only are they visible, but that people are going to be watching much more closely on what they do. So again, I don't want to go on too much longer here, but my advice starts with transparency and communication, including communication with what others are doing, and really applying that to the circumstances in the community in which you reside.
And let me add to that, Russ. With the transparency, what we're talking about today is air, and you can't see air. You can see the hand sanitizing stations. You can see the 6-foot distancing decals on the floors. You're really going to have to put a campaign together to show people the air they can't see.
All right. Thanks, Josh. Next question. Billy Miller says, hey, we had an indoor air quality test which determined where we can upgrade the filter. So he's created the science in terms of where he can make those changes. Chad Webster has a question. He said, when you talk about pressurizing the building and pushing air out of the doors prior to an event or concert, how long should you have the doors open? That's a technical question. I'm gonna have Josh try to answer that one.
All right. So we're not pressurized. We're talking about putting a negative pressure on the building. We're opening the buildings that are doing this are opening the exterior doors, opening all the doors into their bowl and utilizing their exhaust fans in the bowl to draw that outside air through the concourses through the bowl for that flush. Most of them are doing it for at least an hour. Again, it's a hard number to measure as far as air exchange. But they're doing it for at least an hour or two, but it's going to be dependent on what your system is capable of then getting back in control prior to opening the door or reopening the doors for the public. And it depends on, if it's 30 degrees outside, it's going to take longer to get that temperature back up. So you're opening the exterior doors to allow it to draw. You're not creating we're not over pressurizing, we're creating that negative pressure.
Thanks, Josh. Tim Balf said, please address the liability insurance issues in this topic.
Actually, I love that question.
Yeah.
I think somebody on every one of our staffs should be the 10th man, the person who said their first response to everything is what's our liability, what's our risk, how are we mitigating it? So appreciate that. Interestingly enough, no one has to come to our buildings. And so, your ticket is a revocable license, as an example. And so from a pure liability standpoint, the idea that someone makes a decision in an environment like we're in right now to come, they have a seat at the table. I think that from a liability standpoint, there's two things that come to mind for me quickly. One is, if you say you're doing something, you damn well better be doing it. So, I mean, liability comes into case and saying, oh, we made a whole list of all of these things, and in reality, you weren't doing it. And if somebody had an issue, then that's something that's indefensible, and it wouldn't really help you. I worry about liability. We're sort of racing to open in California right now. And the biggest problem I have is that we don't have a single source of truth in the state of California, or from a federal standpoint, like the TSA sort of fly list, that type of thing. That means that the health department is saying to us, you can open your building. I can have 20% of my capacity in my building today if I chose to. On the other hand, the vaccination card, which I happen to have one, but I could make a bunch of them up on my copier. Right now, it's suggested that we're to trust that card. And I find myself, the nightmare I have is with a plaintiff attorney saying, well, Mr. Simons, how did you verify that this person had a vaccination, as an example? And I'm going to say, well, they showed me the card. Well, do you think that those cards could have been, well, how do I answer that? And then if somebody unfortunately got sick and claimed they got sick at our place, and then, how do you defend all that? So, those are a couple of my comments, but it's worth being worried about. And it's important that you talk to your risk and your insurance carriers and make sure that everybody's aligned before you just sort of throw the doors open so you can take cash. Just think about what that would look like from the other direction if something had happened. But if you're not actually doing all the things that you said that you were going to do, then you're in an indefensible position, and it's not going to go very well for you.
Thanks, Russ. We're at the end of our Q&A. One last comment from me. I think, the major takeaway from this is we think you should be proactive instead of reactive. Be thinking about your mechanical systems and putting your plan in place, because if you haven't started putting your back to work plan together and creating a comprehensive document that you can share with your local authorities, at some point you're going to be asked about this. You may not have been asked about it up till now, but we encourage you to be proactive about this, because your indoor air quality is going to be, you're going to get that question at some point as you move into this transition phase. And so with that, I'm going to hand it back over to Richard to talk about our upcoming programs.
Great, thanks. And so as we wrap up today with yet another great session, we have a couple coming. Next week, rewards and recognition, and we're thrilled to have two of the top guest experience leaders in the country that will be on. And we're going to talk about ways that actually truly effectively motivate all of our event staff and people connected to making our performing arts and convention centers and arenas and stadiums sing, because they're the ones in touch with the customers. And so they have some great insights and tips for all of us to better understand. So Patrick Scanlon with the Cleveland Cavaliers and Toya Lasaria from SoFi Stadium, again, two of the leading in the country, will be with us in the United States, will be with us tomorrow. And then our last session in this particular series is about the focus around analyzing your operations. And again, we have just a stellar crew. Anthony Bonavita from Rocket Mortgage Fieldhouse with the Cleveland Cavaliers, Kim Baker, who's CEO with the CEO at the Kentucky Performing Arts Center, and Maburka Butt, people and corporate strategist, all just top of the list in terms of operational analysis. And our VSG team will also be on with them. So there are things that you really want to know. And there's never really been a better time than now about the actual overall operation of your venue. As you reopen, this is the chance to make those changes. So those are our upcoming events. Thanks again for joining today. We had a great crowd. This video and recording will be up, so be sure and pass it on to your coworkers, friends in the industry, your bosses who may not have been on today. And we had many leaders that were also on, and a special thanks to Mike and Josh and John, and always our fearless leader Russ for a great job. So thanks until next week. Great having you with us.
Thanks.